Hi, I'm Dr. Monica Getty, consultant physician, Pace Hospital, Sci-Tech City. Today, we are here to discuss about adult vaccination, why is it important, and why vaccination is not just only for kids. Usually, after a certain point of age, the immunity which is provided by the childhood vaccines wean off. So, and also the immune system weakens. So, we need to retake the vaccines which we have taken already in the childhood so as to develop more immunity towards infectious diseases like influenza, pneumonia, etc. And also, it will reduce the incidence of infections, hospitalizations, and serious complications like deaths. So, coming to the effectivity of the vaccines, the effectiveness of the vaccine depends mainly on the kind of vaccine, whether it is live or attenuated, the disease what it is fighting against, and also the health and age status of the individual. So adult population usually requires vaccines like pneumonia, influenza, pneumococcal vaccines, meningococcal vaccines, MMR, hepatitis A, B, HPV virus vaccines. So in this tabular form, we have the vaccine, what is the recommended dose and schedule of the vaccine. In India, the pregnant women are required or recommended to take certain vaccines like Tdap or TT, which gives protection against childhood and maternal and fetal tetanus. It is given in 2 doses. The first dose should be given in second trimester and the second dose should be given 4 weeks after the first dose. The other vaccine which is recommended for pregnant women are influenza vaccine, which is given as one single shot annually. So there can be a doubt expressed where what kind of vaccines are to be avoided during pregnancy. So during pregnancies, certain live attenuated vaccines like MMR, varicella and herpes vaccines, HPV vaccines should be avoided in pregnancy. Tetanus booster should be given once in every 10 years. Where you can take either Tdap, which will give protection against tetanus, diphtheria and pertussis, or just TD, tetanus and diphtheria, which is given once in every 10 years, or you can take a TT shot. But if you are involved in an accident or any wound which is dirtier and the wound is deep or the cut is deep and you have not taken your tetanus shot since last 5 years, you need a booster dose of tetanus vaccine in between these 10 years. Vaccines have certain side effects which are usually short-lived. The most common side effects include local reactions like redness around the injection spot or inflammation around the injection spot or tenderness around the injection spot. And the systematic complications include allergic reaction to the vaccines, fever which can be low grade associated with headache or body pains. Some patients might complain abdominal discomfort, nausea or loose stools also. But there are serious and rare complications which include the anaphylactic reaction, which is so severe that there is blockage of respiratory tract, etc., and Guillain-Barré syndrome, or differences in platelet production like thrombocytosis or thrombocytopenia can also be seen, but these are all very rare. Another common question what everybody asks is, can we take 2 or more vaccines at the same time? The CDC, WHO and other health organizations endorse co-administration of several other vaccines barring any contraindications. For examples, like in case of live attenuated or live vaccines like MMR and varicella, at least a gap of 2 to 4 weeks should be given to avoid interactions. So there are certain techniques that needs to be followed when we are co-administering vaccines. Usually, if we are co-administering vaccines, they are given in separate limbs, or like you give one vaccine to one arm or the other limb, etc., like that. But if in situations where we have to give 2 vaccines to the same limb, at least a space of 1 inch should be maintained between each injection. Diabetes and adult population are more prone for higher risk of repeated infections, and the infections will go prolonged if the diabetes is not under control. So actually giving them the booster doses of all the recommended vaccines would actually help them not to fall sick very often, or not to get repeated hospitalizations, and they can avoid further complications because of getting repeated infections. This is one of the most common doubt for cancer patients who are being treated or have already had cancer and now there's no relapse in disease. The most common doubt would be, can we take the vaccines according to the schedule, or do we need any specific cancer vaccinations? The regular vaccination schedule for adults can be followed in case of cancer patients also, but we have to check whether they are actively undergoing any chemotherapy or radiotherapy. In cases where they are actively undergoing chemo and radiotherapy, the vaccination should be given either 2 weeks or more than 2 weeks prior to the initiation of chemotherapy, or if the chemo or radiotherapy is done, they can be given after 4 weeks of the procedure like chemo or radiation. But in cases of specific conditions like stem cell transplantation, it would be recommended we wait for more than 6 months to get vaccinated. There are certain vaccines which are avoided during chemo and radiotherapy, as there will be immune suppression in most of the cases. So live vaccines like MMR and varicella are usually avoided.